This is Trump's Treasury Secretary and hundred-millionaire Scott Bessent saying the quiet part out loud about the so-called Trump accounts for newborns provision in his massive government spending and tax cuts bill.
If you have these accounts, like, why are you investing it this way? How are you doing it? How can you understand the power of compound interest? And also at the end of the day, that I'm not sure when the distribution level date should be. Whether should it be 30 and you can buy a house, should it be 60? But in a way, it is a backdoor for privatizing Social Security. Like, Social Security is a defined benefit plan paid out that, to the extent that if all of a sudden these accounts grow and you have in the hundreds of thousands of dollars for your retirement, then that's a game changer too.
Yep, you heard that right. The one-time $1,000 deposits given to children born in the U.S. between 2025 and 2028, which parents can contribute to each year until the child turns 18, are serving as sort of a trial run to wean the younger generations off of Social Security and hand over that business to private firms, banks, and other institutions to manage and make even more money.
Trump administration is going to make every newborn a shareholder, and they are going to have a stake in the system. When you have a stake in the system, you do not want to bring down the system.
My job as your representative, as a congresswoman, is not to make sure that you are healthy and safe in every aspect of your life. If so, I'd probably send you a Peloton and a gym membership, and then make sure you're buckling your seatbelt every time you get in a car. Maybe I prevent you from even being in the car. But my job is to keep you free.
Lauren Boebert couldn't have been clearer. Republicans couldn't care less about making your life better or working on your behalf. They're only in office to advance their careers and reap the benefits from their donors, all at our expense too. And Social Security is far from the only life or death government service on the chopping block to be completely privatized if the Republicans get their way.
The budget slashes nearly $1 trillion from Medicaid over the next decade. 17 million Americans could lose their health insurance overall. One estimate projects 51,000 people will die each year as a result of the cuts.
Medicaid is the largest payer of long-term care in our country. 69% of all direct care worker wages, the wages of the workers who we count on to take care of our aging parents and our disabled loved ones, comes from Medicaid. There are already 700,000 people who are on waiting lists for Medicaid home and community-based services. That means the care and assistance that older people and disabled people need in order to stay in their homes connected to their communities. With these cuts, all of that infrastructure, all of that is at stake.
Republicans are so motivated to cut government spending to social safety nets because they are so worried. They're so focused on individual greed, on making sure that these things are privatized. They want to reduce government spending, right? And that it's going to help with inflation and all that. But it's because they don't care about the lower class. They don't care about the poor. They don't care about the middle class. No, they care about their donors. They care about themselves, and they care about the rich. And here's the thing. This is going to hurt their base, at least part of them. You have poor Republicans. You have middle-class Republicans who are struggling in so many shapes or forms, whether it's with their job or their insurance, right? Or with Social Security, and making sure they have access to that. And yet, Republicans are doing everything in their power to take that away from them, even though they'll sell it as this is going to make America better. Well, it might make some people's lives better, but it's definitely not helping the general public. It is helping the 1% and the elite.
The beautiful for billionaires bill that the Republicans forced through on a purely partisan basis cuts Medicaid explicitly $1 trillion cut to Medicaid. So folks who are on Medicaid are going to see a real danger in their lives as a result of those cuts. You may say, well, I'm not on Medicaid. I've got private insurance. I've got Medicare. I'm going to be fine. Not so. When the cuts are that big, they knock essential revenue away from hospitals, away from your family doctor, away from health centers, away from nursing homes. And I don't know about all the other states, but in Rhode Island, all those institutions are struggling. This is not easy times for people who are providing health care in our healthcare system. And when you knock $1 trillion out of their pockets, because that's where this goes. Medicaid money doesn't go to individuals into their pockets, it goes to their providers. When you take away that revenue from the providers, you put them at risk. You don't have to be on Medicaid to be harmed if your nursing home closes down because it has gone broke because Medicaid funding is no longer available. So the Medicaid cuts are right in our face. And the damage that they're going to do to healthcare institutions is obvious.
And let me remind you that the spending cuts just don't affect patients receiving healthcare, but also the healthcare labor force, many of whom are immigrants, first-generation citizens, or just regular working-class people barely scraping by on what they're paid now, despite the importance of the services and care they provide.
I could run a tape here of all the Republicans who said, oh, we're not going to cut Medicare. Oh, Medicare is different. Oh, we're going to protect Medicare. We've heard the president say it. It was all hogwash. It was all complete hogwash. The sneak attack is underway, and I'm going to tell you how it works. It works because the Beautiful for Billionaires bill added $3.4 trillion or more to the debt. The Republicans had to lift the debt limit by $5 trillion. So it's a big number added to the debt. And when that much added debt gets dumped onto our fiscal picture, it triggers another law. It triggers a law called the Statutory Pay-As-You-Go Act. Our technical term for it around here is that it triggers sequestration. And when you create that much added debt, when you run up deficits that badly, as the Republicans have done to fund their billionaire tax cuts, here's what happens to Medicare. And this is from the Congressional Budget Office. It triggers a $45 billion cut to Medicare in 2026. And it will increase each year to about $75 billion of an annual cut to Medicare in 2034. Between 2026, next year, and 2034, this trigger will produce $535 billion in cuts to Medicare. They don't want you to know that. They don't want to tell you that. They'd like it to just happen automatically so they don't have fingerprints on it. But their fingerprints are all over it. So what we should be doing is passing my bill to put Medicare and Social Security onto a permanently sound footing, as far as the actuarial eye can see, by simply lifting the cap on how much of your income is subject to Social Security and Medicare contributions. Easy to do, very simple, very fair, makes Social Security and Medicare solvent essentially indefinitely if my bill passes. That's what I'd like to be talking about. Instead, we've got a direct attack on Medicaid, a rebound attack from those cuts on the major institutions of our American healthcare system, like our family doctors and our hospitals and our nursing homes, and a sneak attack through the pay-as-you-go provisions on Medicare to the tune of over $500 billion.
This spending-cutting scheme is a direct attack on the working class and anyone who doesn't have insurance through their job, can't afford to pay out of pocket for costs, and people with disabilities that require long-term intensive care that don't have the financial means to afford said care. Again, this is hurting so many people who are not a part of the 1%, who are not rich millionaires or billionaires. It is going to devastate so many Americans who are just working hard to put food on the table for their families and are working hard to stay healthy and just be able to survive in this society, in this climate that we're in, socially and politically, and even environmentally. For Rebel HQ, I'm Chris Williamson. We'll see you next time.